Live from CNN Atlanta, this is Connect the World.
Hello and welcome to Connect the World. I'm Lynda Kinkade, filling in for my colleague Becky Anderson. Good to have you with us. Well, the scenes from India's capital today are shocking and difficult to watch. Crematoriums in New Delhi and some of the country's other big cities are operating around the clock as cases pile up and the death toll rises. India is reporting a global record of nearly 380,000 new cases Thursday. Now more than 18 million infections in total and more than 3,600 deaths. And amidst the suffering, people are still voting, as you can see, lining up at polling stations in the West Bengal state. Prime Minister Narendra Modi, who has been criticised for allowing large campaign rallies and religious festivals, is telling voters to follow COVID-19 protocols, but to get out and vote. International help is now on the way, some of it already there. These are oxygen canisters being sent from the United States. Countries across the globe have answered the call to provide life-saving equipment. India's government is also trying to speed up its slow vaccine rollout, expanding eligibility to anyone 18 and older starting Saturday. The Health Ministry says 12 million doses are in the supply chain, both in storage and on the way to their destinations. But less than 10% of the population has been vaccinated so far, and vaccines remain scarce, with state ministers appealing for more doses as soon as possible. Well, our correspondent Sam Kiley was at a New Delhi crematorium earlier, and some of the images in his report are disturbing and difficult to watch.
This is the Simapuri crematorium where the dead have to join a queue. Their relatives or friends have to take tickets from an office in order to get access to the crematorium that is dealing with about 150 people a day, almost all of them victims of the COVID pandemic, a pandemic that the government seemed to indicate earlier this year had somehow passed India by, that India had somehow reached a level of herd immunity that even countries that have vaccinated on a vast scale have not reached. Now, India's a net exporter of vaccines. People here squarely blame the government for this catastrophe that has unfolded. And this, after all, is a nation that can put aircraft carriers at sea, that has a space program, that is the center for many international corporations of IT and development, but is also a country where there are catastrophic differences between the very rich and the very poor. And here, it's been extraordinary because a lot of the victims of this pandemic have been middle class. They're the ones, perhaps, who can afford to have their families burnt in a facility like this. And it may indicate one of the reasons as to why a lot of the estimates for the number of dead and the number of people in India who've been infected may be woefully inadequate. Sam Kiley, CNN, New Delhi.
Well, Sam was also there at the crematorium well into the night. Here's what he told me last hour.
Well, Lynda, just in this area alone, it's about the size of 3/4 of a football pitch. There are close to 50 pyres burning. This crematorium believed it would probably process about 150 bodies today. There's estimated about 600 people dying every day here in New Delhi, but the truth of the matter is the numbers must be much higher. In this crematorium, the dead actually have to join a queue before they can be seen, before they can be given their last rites. People accompanying them have to take a ticket, like you would going to see the doctor or getting a bank appointment, wait their turn, and then they will be brought out to one of these locations. Ghee, which is a butter-like oil substance, poured on them, the wood piled on top, and they're given their last rites, very often unattended by anybody else other than perhaps one family member or a friend. There was one gentleman I spoke to earlier on today who lit that pyre there, and he was in attendance only because no other member of the deceased family could be there because they had all caught COVID, Lynda. This is a catastrophic result of a failure in public health. Narendra Modi, the Prime Minister here, believed a few months ago that India had broken the back of the pandemic, that they'd somehow achieved herd immunity, and India was becoming a net exporting nation for anti-COVID vaccines. Indeed, the national program, excuse me, doesn't get underway in serious earnest until May the 1st, when the number people from 18 and above will be allowed to get the vaccinations. There's been a rush of applications, but there's nothing like the level of supply that it can be met. And at the same time, he has encouraged political campaigning in local elections for his BJP party, mass meetings, people not being socially distanced at these meetings, and then the Hindu festival of Kumbh Mela, where more than 2 million people are believed to have attended, all cheek by jowl, all plunging in and out of the river Ganges, celebrating this very important Hindu festival for them, but all of them participating in a super spreader event. And I'm afraid this is the result, Lynda.